Hi there, Dr. Blake Cason, chiropractor in Denver, North Carolina. We're here at the clinic, the On-Site Alliance Health Center, and we're going to be talking about sciatica. We're going to be talking about the treatment, we're going to be talking about prevention, and we're going to be talking about some of the causes. So let's dig in. Now, what is the sciatic nerve? The sciatic nerve is actually the largest nerve in the human body. So when there's a problem with it, it's definitely going to let you know. You're going to feel that from the floor all the way up to your low back. 5 nerve roots on each side of your low back. You think that's a big nerve? Yeah, that's a big one. Very big, okay? So those nerve roots come together, they're going to form the sciatic nerve. When you have a problem with the sciatic nerve, we refer to it as sciatica. Usually a lot of pain involved with that one. So, if you've got that going on, give me a call. We're going to figure something out about that. I'll show you a little bit more about how we fix it. Now, what's the cause of it? This guy right here, huge cause of sciatica. He decided to get in a car that's a little too small for him, okay? His low back crunched right now. Look at this. He's flexed in the flex position. His knees are up here with the turn signals. I don't know. What was he thinking? So my patients, they come to me, they tell me that they drive at least 30, 45 minutes one way or each way to work. So that's what, an hour and a half almost? 2 hours for some people every day. Then they get out of their little tiny car and they go work in the computer station area. What do you call those? Cubicles? Do they still have cubicles? I don't know. I stand all day and adjust bears. I wrestle bears all day. So let's look at another one. My personal favorite. This is an oldie but a goldie here. This is one that when I was a young chiropractor, we like to use a lot. Let people know that the wallet on one side of their pants here, if they sit on it all day, can cause problems over years. This guy's got coupons from 1985. He's got at least 2, maybe 3 maxed out credit cards in there. Maybe some cash, I don't know. Dave Ramsey, you know what I'm talking about? He's got a little cash in there. Maybe he doesn't, maybe he does. Okay, so you put it on this side, your pelvis is gonna rock to one side. It's gonna rock, cause that curve in your spine. You can't sit like that all day. That looks uncomfortable. Imagine that in a tiny car in front of a computer all day. You're gonna start seeing problems. Yeah. Okay, another one that comes into the office a lot, you'll see this just about anywhere you go. People that are overweight or have some obesity issues, what we want to do is see how gravity affects their spine. Okay, now first you're going to see there's an increased curve in their low back and an increased curve in their neck. That makes the spine unstable, already added pressure on the nervous system. So then you're going to see a severe pull from the north. Going to start moving down here from Florida. It's going to pull all that pain and pressure. Is going to pull all that in front of the spine. Going to cause huge problems in this area and this area along the eastern coast, the eastern seaboard there. What you want to do is you want to start losing some of this so you can save some of this. So the rest of your brain can talk to the rest of your body through the nervous system. We know it's got to change, right? Come to my office, I'll show you how to fix all this. Okay. Get in where you fit in. Or not, But what I find is people that tend to be in places that they really shouldn't be, or they've got things that just don't fit where they are, that they tend to have problems in their spine. So if you're noticing something that's bothering you over time, let's address it and fix the problem, because I don't know how cats sleep like this, but for me, this just isn't comfortable, okay? And over time, it's gonna damage your nervous system. And when your nervous system gets damaged, your body can't heal itself. And then, who knows? Maybe you need more medication, more surgery. But I know you weren't designed that way, so let's try to fix the problem. Start by taking a break. Give your spine a break, give your body a break. What you need to do is relieve your stress. The way that I do it is I work out 2-3 times a week. I practice jujitsu. I do yoga and stretching, and I get adjusted on a regular basis. and that helps me relieve a lot of stress, physical stress in my body, but not to mention the chemical stress that builds up through the stress hormones. So you might want to find ways of relaxing, relieving stress, and just overall getting healthy, okay? 2020 is coming up. I know that's a great resolution for a lot of people, is to add this kind of stuff. Breathe in, breathe out. Do as the dog does. They're pretty happy, right? Except this guy. He's not very happy. His feet are above his head. He's obviously been texting, not looking at the warning signs. Just like our body gives us warning signs that there's a problem. Might want to watch out, might want to pay attention. So he's texting on his phone, just not paying attention, and boom, it slips on the wet floor, ends up upside down. He's probably on a way maybe to a very important meeting. He might be an overachiever or just very annoying. Some people saw this and probably laughed, didn't tell anyone except their friends, maybe on Facebook. Oh, there he is again. I'm going to say this guy probably deserves it now. That's the second time he's fallen there. And judging by the direction that he's fallen, this might be a little workplace violence, you know, because the floor was wet. He's fallen twice, maybe more, and, you know, you never know. Looks like he might have even gotten pushed. This is how falls happen. This is how injuries happen. You got to watch your low back. I'm sure his shoulder hurts him too. Oh, definitely. Workplace. Actually, this guy's got papers on the floor. This might be like a Wednesday, and he's just given up. He's completely decided to stop working in the middle of a busy day. I can tell. This guy, you definitely want to give me a call. We'll get to the bottom of what's going on internally. I'll fix your spine. You're gonna be feeling great. What you want to tell yourself is, you know, it's not about how many times you fall down, but it's about how many times you get back up, buddy. Call me. All right, here we go. Causes of sciatica. This is the important stuff, right? This is what you came for. This is what you want to know, because this is what I help with. All right, so let's look at some of the causes. Bulging disc, inflamed joint, muscle spasms. What's going on there? So let's look at the muscle spasms. Number one reason that I'll see a muscle spasm happen in my office, because the joints of the spine have maybe they're just a little unstable. You know, they're not as strong as they used to be because they're misaligned or they're weaker. And these muscles around here, they're actually going to grip up around that area. They're going to grip up to protect that area like a weight belt. Sometimes when they do that, to make that area a little stronger and stabilize that area, it starts pinching some of those nerves through there and can mimic sciatica. So there's one issue that you'll see. Another one is the bulging disc. A lot of people have heard of that before. You know, the disc is basically the shock absorber in between the two spinal bones there. Sometimes that spinal joint can misalign, especially over time, and cause uneven wear and tear on that disc. And when it's not, when the disc isn't performing properly, it'll bulge and it will put pressure on those nerve roots that we talked about earlier, and that'll basically send sensations right down your sciatic nerve. That's your sciatic problem, right? So the other one that I see a lot in my office is the inflamed joint. Okay, that's another joint that's not moving properly in the spine, and the body uses inflammation to heal itself, and that inflammation has been there on day 1, 2, and 3, and for 5 to 10 years, this inflammation has been building up in this area and causing problems, because it will damage that area, cause swelling as well, just like the disc did, and put pressure on that nerve root. So these are the things that I commonly see in my office. These are the things that I see why they happen. And, you know, as a chiropractor, I'm trained to locate a lot of these issues, where they are in your spine, tell you how they will affect you now and how they will affect you in the future if you don't fix the problem. And I feel very confident about removing that dysfunction from your spine and showing you how to prevent that. All right. So I hope you learned something. If you need anything, give us a call at our office, or reach out and send us a message, and we'll get you some